Welcome to Grassroots from the Nursing Now Challenge, a programme of the Burdett Trust for Nursing. Grassroots aims to amplify the voices of nurses and midwives driving change from the ground up. We're shining a light on how nurses and midwives are shaping the future of healthcare, often in the most challenging of circumstances. This week, we talk to Derrick Bahandagira, a nurse innovator from Uganda, who tells us how he's transforming diabetes care through creative, community-led solutions that improve awareness and access to treatment. Talking to Derrick, Ernest Lamuel, registered mental health nurse and Challengers Committee hub lead from Southeast Asia, and Lincoln Gombedza, a registered learning disability nurse and Challengers Committee hub lead from Europe.
So a very good morning, good afternoon, and good evening to everyone who's present here. My name is Ernest Lamuel, and I'm one of the co-chair from Southeast Asia Challengers Committee Nursing Now Global Campaign, and I am having my partner here, Lincoln Gombedza, who is also a co-chair for Europe region, and we are here today with one of the nurses from Uganda, namely Derrick Bahandagira. Please forgive me if I'm pronouncing it wrong. So, hello, Derrick. How are you doing?
I'm doing well, thank you.
It is always such a pleasure having these different perspectives and experiences all around the world. And Nursing Now Global Campaign stands for and serves for these initiatives. And we are very grateful that you have this interest of sharing your experiences with us. So without wasting any time, let's begin. I'll be asking you certain questions, and then you can respond how you have experienced in your career being a registered nurse. So my first question is that, can you tell us a little bit about yourself and your background? Where have you worked, and what inspired you to become a nurse or a midwife?
Thank you, Ernest. My name is Derrick Bahandagira. I'm a registered nurse with more than 4 years of experience. Been working at Fort Portal Regional Referral Hospital and an organization, which is a charity organization registered in the UK and Wales. It is called Knowledge for Change. And I'm a lead in diabetes in Fort Portal. I'm also a member of Challenge Committee and Nursing Now Challenge Uganda, Africa. I'm a scholar in International Collaboration Committee for Health in Nursing Research. I've been in UK in June, and they presented my research on sexual violence. And I'm
that was a nice time being here.
Soon completing my research, which will be published very soon. I have published a paper on fungal innovation in wound management with the lower resource inpatient setting.
Right.
I've been an abstract reviewer in an International Conference of Family Planning 2025, in which will be in November in America. I'm also a mentor, a supervisor for international students who come to Uganda for their placement. Students from UK, from University of Salford, Manchester, Switzerland, Liverpool. So I'm their mentor. And also I had a small course in Nursing Now Challenge, which was Emerging Nursing Leadership Fellowship Program, which I completed in 2022 to 2023. That's what has boosted me to reach over here. So that's all about my small background. And why am I a nurse? Growing up in a community where people are lacking and where you find the challenges are more. And I was grown up by my grandparent who had cancer. And by that time, I was the immediate person who was caring about my grand. So I pursued a course in nursing. From that time up to now, I'm a nurse in my community.
Impressive. I must say that you, being at your age, you have expressed and taken interest in so many fields, whether it's research, whether it's academics, whether it's being a teacher, a mentor to international students. So I am very much impressed, and I'm happy and blessed to have you here with us. Lincoln, you can proceed to ask if you have any questions for him.
For me is, just reflecting on this work
Mm.
that you're doing. I just wanted to ask, just one question, really, to be honest. What are the key moments for you, in terms of your journey as a mentor, and what are the barriers, with this piece of amazing work that you're doing at the moment? Yeah.
After joining nursing, I did my course. I didn't get a job straight away. So, but I didn't also sit down. I did some small things. And after that, I started volunteering in a community health center where I was working there for more than 9 months. By that time, it was the end of COVID, but still COVID was in there. So I got opportunity to hear about Nursing Now Challenge. It's where I was still a early career nurse. Then
Mm.
within that, it's when I got opportunity to be part of it. Then I applied. Then I was nominated and I got a small funding to pursue that course, which is Emerging Nursing Leadership Fellowship Program. And that program really boosted my knowledge in nursing, leadership, and quality improvement. And all my journey started from that and everything I'm doing currently.
That's yeah, amazing. That's we'll touch on some of those key points anyway when we are thinking about the funding, and it's clearly obvious. The Nursing Now Challenge. For me, it was transformational, and it's amazing to hear from you that it really played a major role in everything that you're trying to do. So yeah, thank you. That was my question. So over to you, Ernest.
Okay, thank you, Lincoln. So continuing with the conversation, Derek, I was hoping if you can share some information about that what challenge or gap in care did you notice in your area, in your clinical setting?
Well, working in a lower middle income countries, we are full with a lot of challenges,
Mm,
but there is some which you always see that they need a solution. Others you may find it is administrative part. But working on surgical ward made me realize that there is extensive problem with people who are living with diabetes. But in
mm,
Uganda, you can't easily tell if it's a type 1 or a type 2 diabetes because we
yeah.
don't have confirmatory investigations which we do on
Mm,
patients. So many patients have been admitted on the surgical ward because of diabetes complications. Someone comes already, it's late, and there is no way we can reverse it. Mostly people who come on wards, they have a diabetic foot ulcer, which is
Okay.
bringing them to surgical ward. And when they come to the hospital, some of them, they will not know that they have diabetes. So they come as newly diagnosed because they have confirmed they have diabetes when they reach in the hospital. As the research says, the number of people who are having diabetes who know that
yeah,
they have
yeah.
diabetes is equal to the number of people who don't know that they have diabetes. So it means if there is 5 people who already know they have diabetes, there is another 5 people who don't know that they have diabetes, but they have it. So which was a big challenge. A lot of people were coming, they don't
Mm,
have any knowledge about it, and it is thing which they feel like, no, I can't have diabetes. Other
yeah.
think
Mm,
that, oh, it's a kind of witchcraft. In Africa there is kind of witchcraft. Other people call it juju.
Yeah,
So
yeah.
they are in denial, but they have come with a diabetic foot ulcer, which makes them to come in a surgical ward. By that time, they will want to try to do debridement. Debridement is kind of cutting off the dead tissue
right.
so that they
Yes.
Mm,
can heal. So at the end, some of them will come when it is already late, and they end up going into amputation, like after having a series of debridement, cutting that skin, you reach into the bone and they end up cutting their foot. So many of them were losing their foot. So I found it is a challenging because there was dressing their wounds, and they found this is a big problem. Like why people are not aware about diabetes, why most of people are coming over here and end up into amputation, but they came with two legs. So I started looking into diabetes, and in my research, I found that back days, people used to lose legs because of road traffic accidents. But
Yes.
currently, when you try to see around the world, it's now diabetes. A lot of people are losing their legs because of diabetes. So I ended up looking into that, and it was like, no, we need to do something about it. So that's how the challenge came in.
I'm a learning disability nurse. We've got a report that's come out. It's called the Leader Report, which shows the deaths amongst people with learning disability. And we are seeing some of the data here in the UK. Diabetes is the main issue, especially amongst people who are disabled. So, is this something that you're also finding in your country as well? Around this issue, in terms of how I know these were the main challenges for you, but how did you, what actions did you take in terms of trying to address that and also trying to address this problem with people who are disabled, in our communities?
I will bring it back. In 2023, I got an opportunity to come to UK.
Mm.
So I had the exposure and I met different mentors, diabetes specialist at the University of Salford, Manchester. I was also connected to join the Diabetes UK conference. By that time, it was in Liverpool Exhibition Centre. So I was there for 1 week. So I acquired knowledge and skills in managing diabetes, and at least I built a strong network and collaboration with some members I met at that conference. Also, I had a small, like short placement in Phoenix. It was in Phoenix Highwood Clinic. It was for
Okay.
diabetes, and also I had 1 week placement at Cambria. There is a hospital there, Chamberlain Hospital, just shadowing the specialist. And I realized over in UK, people do different things than us. So I
Yeah.
found in UK, they have programs. They have program like Daffin, which is a dose adjustment for normal eating. They have Desmond, which is a diabetic education and self-management for ongoing and newly diagnosed uh, patients. This inspired me. Like I found where a group of patients, like 9 or 5, they meet themselves and they discuss about their condition. Yes, well, they are educated, they know, but they discuss about their condition. This means they will reduce stress, they will teach one another. Then it was an eye opener. I found like we need something like this back at home. So after the conference and all this placement, I had an idea. I had to meet again the specialist, and we wanted to do something back at home. So by that time, with the team from University of Salford, we sat down and we came up with a idea of having educational program to bring back on ground. So it's when I came up with the needs program. Needs program, it's a word which I was using, when we at school, you can
Mm-hmm.
have the way how you have your words like, if they bring diabetes, I will manage this. So if they bring
Mm-hmm.
diabetes, I would go to the exams with the word needs. I know people with diabetes, they need nutrition. You have to talk about nutrition. They need education. They need exercises. They need drugs, and they need self care. And when we had our meeting, this was the something I had to raise up, and everyone was okay to have the name needs as a educational program.
What are the obstacles, or if there were any obstacles that you faced, and if you did, what were them, and how did you manage them and move forward?
Obstacles are always in
Always
low
there.
middle income
Yeah.
countries. They're always there.
Yeah.
One, it would be funding. When we started this program, mainly we wanted funding. Our program wanted to do a pre-screening where that
Mm.
pre-screening we should start with HbA1c testing. HbA1c, people living with diabetes, it tracks their glucose level for 3 months.
Mm.
As we started our program, we had a pre-screening tool where that the patient doesn't know anything about diabetes or has wrong information or doesn't
Mm.
have clear information. So it's like a new patient who don't have enough information. And the obstacles we had, we didn't have good funding for HbA1c test. In
Mm.
our area where we come from, it was in one place, and which was a private facility. It means in the
Mm.
government facility,
Mm.
the machine was not working. That was the first obstacle, which we really wanted to have the HbA1c. So also, as I said, it is a program for multidisciplinary team where we had a pharmacist, nurses, midwives, doctors. We had a nutritionist to talk about food. We had orthopedic technologist, as Likon told about some people lose already their limbs. So we need an orthopedic technologist to go through that. So it was a multidisciplinary team where you find sometimes you don't have enough staff, or if
Mm.
you pull one staff in one position, it means there will be a gap.
Yeah.
There is no one to
Mm.
fill that gap. So also it was a big challenge. You know, back in Uganda, I would say in Africa, where if you call patients, most of them they will expect drugs because most of
Mm.
them they come in the hospital to pick drugs, like mostly diabetic
Yes.
patients. So if you call them to give them information, for them the information they may think it's not enough. The only thing they would take back home, they know medication is better than information.
Mm.
So also it was a big obstacle.
Thank you so much, Derek. And I mean, the more I listen to you, the more
Mhm.
dynamic picture it becomes, and especially with
Yeah.
you going through with so much, and especially as you mentioned that there is not always an ideal situation where you can continue your work, and especially having that much support from the government or the organization,
Yeah.
it is very hard to make your vision your reality. With that said, I wanted to know, what did you as a nurse learned about yourself
Mm.
and while
Yeah.
going through this process?
As a nurse, we keep learning. As we say, learning is a process.
Yes.
One thing I would say, I have also built my self-awareness where I
Mm.
can at least understand my strength where it lies and the changes which I can bring, my weaknesses and my
Yes.
areas of improvement during this period. Also, I have developed at least my problem solving skills where
Mm.
using the limited resources to
Yeah.
bring out something which can be supported by others, can help the patients with the limited resources. I've also learned that I have developed or built more about my communication skills, where
Okay.
I was
Yes.
taking health education as it was the key point in a needs
Yes.
program.
Mm.
Reflecting on your experience working in MDT, I just wanted to bring back to that point because sometimes, we as newly qualified nurses as well, we do work in MDTs and, we're part of, that resistance. Did you face any resistance, in terms of what you were asking for? Just reflect on that a little bit if you don't mind.
They think nurses were always down. Some people know they always think nurses we don't take leadership. That's
Yeah.
what is in people's mentality. But of course, I will give an example where we started this program. We wanted to start bringing every doctor on board, but many of them, they didn't give us time because they thought maybe why nurses are the ones to bring this first. If it was another doctor to start up this, I would say they were going to come. But because it's an initiative brought by nurses, that resistance is always there. So I would say in our culture where people think that nurses, they are not always taking the first step in solving problems, that's also bring resistance in other activities.
This is it. This is it. If anybody's watching this, did you hear that? This is everywhere. Nurses,
Yeah.
people think nurses, we can't take leadership roles. We can't, Derek here is an example of,
Yes.
nurses who are taking leadership. Thank you for sharing that. Yeah, Ernest, over to you, my friend.
Thank you. I think I can I can keep asking for hours and hours, and I can continue listening to Derek because
Yes.
being a nurse ourselves, we relate, and I think everyone who's listening to Derek would relate on a deeper level, on a personal level, how he is going through this journey and with all of these, like, I would say, like, experiences, because experiences are experiences, whether good or bad, they teach us to move forward and have a different perspective towards life. And with that said, I wanted to ask Derek, when you were going through and when you are currently going through this journey, how did your family or your friends or your especially colleagues respond to you on this journey, on this initiative that you have?
At first, it was no one could see the results.
Mm,
So, but with time, everyone started seeing the results. At first, they
Mm.
will say the response was not the same as when it
yes.
went in the middle or at the end. So, beginning, people want to see the results, and results don't come in a day. So you have to start
No.
building something. So the results will
Yes.
come. So I would say didn't get the positive result from the beginning, but as time started telling, the response was positive, and they would say
Yes.
up to now, my colleagues have already extended the program to other facilities. That means people are being inspired and they have seen the positive part of it. But at the
Mm.
beginning, people, I would say, they will not trust in you
No.
because
Yeah.
they can't see the results.
The result. Yeah. I
Yes.
understand. I also wanted to ask you that if you would be able to be in a position or make decisions, what support do you think that nurses and midwives need to lead more innovations like yours?
The support always vary. It depends. As I will also consider mostly we nurses in lower middle income countries.
Yeah,
Mhm.
One will lack exposure.
Yeah.
Um,
true.
I would say training and capacity building is the most important thing, which I would always argue. Like if we require mostly ongoing education programs, every time the curriculum change, every time they update information, and at the end you find someone is still doing like what they learned from school, but the curriculum always change. Like I would say, for example, I take part in wound management, and we always keep changing and learning something new, like the use of normal saline. But because someone's completed nursing in maybe 2000 and is still in work, so it doesn't know that it's only normal salary. So if we do keep doing trainings, someone will learn from that. So I would
Yeah.
say more trainings. I would say also provision of equipment and resources, uh, lobbying for donors,
Mm.
advocating for materials like funding, health care development, mentorship and support, where like experienced nurses you could come and teach the new or the junior nurses so that we can also be on the same level, which is very important. Using the peer support like this
Yes.
nursing now challenge what is doing all over the world, and also mentorship programs for both local and international nurses.
I'll be in trouble if I don't ask this question about AI. Okay. So, because AI is here, and I was listening to, James Manuka. I'm not sure whether you're aware of who he is. He's doing some work, at Google. He's very, very senior. He's born in Zimbabwe as well. And he was discussing about Africa. Africa has got so much talent in terms of infrastructure. How can we build that infrastructure to have AI? What role can Google play, in all these technology companies? So, in terms of you dreaming big about that, what do you think is the role of AI here, and what can we do, or what can I do, or the nursing challenge can we do to partner together to start looking at solutions? Because I think Google are doing quite a lot of good work in terms of the open source technology. I got a few friends of mine who are also looking at how AI can play a role, in terms of addressing some of the issues, around diabetes. So, do you want to share what's your thoughts around that vision? Vision 2040 is what we are calling it here in the UK.
Technology is always welcomed everywhere. I would say you can't live without technology. I would support AI, but in a positive way. Every technology or every development comes, it affects some people. I will not
Yes.
encourage someone who will spend the time, like, for example, if I'm applying for some maybe PhD or master, I only focus on using AI. Or if I'm managing a patient or trying to bring all the care plan, I only use AI. I would want to use AI to guide me to bring out something very well, not only
Mm,
using AI information. Use my
mm.
information, but bring in AI to guide me or
Yeah.
bring it out in a good way. So to me, I give a tick on technology. Like I like technology and I like digitalizing everything. As for now, we are using the digital system in data collection, in
Mm.
managing
Mm.
patients. So it means we are going from using paper and we are going to digitalization. And someone who is climate activist, I will go with AI, I will say.
Thank you for sharing that. Erica, over to you, Ernest.
I have to admit, Lincoln, for the past couple of years since this chat GPT arrived, I used to use it like Google, but then the more I started using, the more it upgraded. I think now it's chat GPT 5 that was launched last month or something. Now I am completely dependent on ChatGPT. I'm asking everything,
Don't be
whether
addicted.
it's related to my studies, or maybe asking prices, or like just random stuff I'm asking. So
Yeah.
I'm also looking forward to what AI is bringing towards nursing. Coming back to Derek, I wanted to ask one last question before we wrap up. Is what would you say to a nurse or a midwife listening who sees a problem but feels powerless to change it?
I would say first, when I see challenges, I always carry challenges as opportunities for growth and learning to me as
Yeah.
Derek. So I would encourage every nurse like to use their voice, because a voice is something which will matter in life,
Yes.
and consider sharing those ideas, concerns with everyone around them, maybe leaders, supervisors, and everyone who we work with. I would say, don't sit on them. You're not alone in this situation. Always, let's work together and we identify potential solutions for every problem.
Derrick's work, folks, in Uganda is shows just how nurse-led innovation through education. I mean, you've heard about the technology, the collaboration, yeah, and ultimately, I think for me, from what I was hearing, is it can save lives. You know,
Yes.
what is very, very important, it can transform those long-term health outcomes for people with living with diabetes. And if you are listening to this podcast and wondering how to make an impact, you've just been hearing Derrick. From Derrick's conversation now is start where you are, start where you are. And that is the essence of this podcast. It's about grassroots.
Yes.
It's about change begins with you, ideas, teamwork. You've heard him talk about teamwork. You heard his determination to improve care. So for me, to learn more about Derrick's project, and Derrick, I'm going to come back to you in a bit, is because I want you to share your details. Of course, they'll be shared on the Nursing Now Challenge. Please do visit the nursingnow.org website, and you're going to find the transcripts of this conversation, as early career nurses. So you're going to get more information about Derrick's grassroots bio, and also ultimately you'll find out how to get involved. You heard Derrick speak about how the opportunities, the funding, him traveling to United Kingdom to do all this work. So there's going to be so much resources there. There's going to be nominate yourself. Nominate yourself. We need more people to come. We need you to
Yes.
come, and really talk about your experience wherever you are. Nursing Now Challenge is global. And if you haven't already, okay, we invite you to join the Nursing Now Challenge. Come to us. The membership is free. You don't have to pay anything. It's free. You just need an
Yes.
internet connection. Come through and connect with others. Connect with student nurses, early careers, midwives. We are a united family. So, Ernest and
Yes.
Derrick, last words. Is there anything you want to add to that?
As I say, I'm not only doing one work in diabetes, I'm doing a lot of work in sexual violence, climate action, and also to follow me, I'm on Instagram. I'm using Derrick Bahandagira, Twitter
Okay.
Derrick Bahandagira, and also I'm part of Nursing Now Challenge committee, which is on WhatsApp. So when you dig in our WhatsApp or you join our WhatsApp group, I will be part of that conversation always. Thank you.
I would also genuinely invite all of the nurses throughout the world to join Nursing Now global campaign, and especially for early career nurses, because when you start your career as an early career nurse, when you just recently graduated, you just don't know anything, and you just want to know everything apparently. And this is a really good start, because I remember when I graduated, like I guess 5-6 years ago, I was clueless what to do and how to interact and how to discuss things with my profession and outside my profession as well. Like what field of nursing should I pursue? Nursing Now global campaign really helped me finding my niche, and that's when I thought about joining mental health nursing. So I would also invite to everyone who's listening to take initiative, and it's just one form away and then you're in. That's it. And when you join, you just feel so welcome and so warmly with all of these international nurses that on these, like Derrick mentioned, on WhatsApp. So you are always connected with your peers. It's such a beautiful experience, and I'm always grateful that I am living in this time in 2025, where because of technology, because of AI, and because of all these things are getting easier. They are not there where they should be, but we are already going forward and moving ahead in time. So thank you, everyone who's listening, and thank you, Derrick, for joining us today, and thank you, Lincoln, for being my partner in this podcast. Thank you.
Grassroots is a production of the Nursing Now Challenge, a program of the Burdett Trust for Nursing. All views and opinions expressed in this podcast are personal to the hosts and guests, and are not necessarily the views of the Nursing Now Challenge or the Burdett Trust for Nursing. For more information about the Nursing Now Challenge and this podcast, including upcoming episodes and featured speakers, head over to nursingnow.org.